The location of the patient's shoulder pain can also be useful in helping determine if it's coming from a shoulder structure or potentially coming from the cervical spine. So as an example, in our clinical practice, patients who present with neck pain need to be evaluated by one of the other healthcare providers first, a physician or a nurse practitioner. However, patients who have just nonspecific shoulder pain are referred directly to PT. And it's not uncommon for us to have a patient get back to PT, and then when I ask them, where is your shoulder hurting, they'll grab their upper trapezius, kind of this area here. And right away, I have to, or often I have to stop and examine the cervical spine and determine if that is the source of their pain, and oftentimes it is. So when a patient says I'm having shoulder pain, it is important to determine the pain location. And if they're complaining more of pain in the area of the upper trapezius, then in my experience I've found that to be more often related to a cervical spine issue than a true shoulder pathology. If the patient complains of pain along the medial border of the scapula, then that could be actually either. It could be a muscular structure, one of the scapular muscles, or again, it could be referred pain coming from the cervical spine. It's not uncommon for the cervical facets and the cervical discs to refer pain into the area of the scapula or into the area of the upper trapezius. So the source of the pain can be valuable for, or the location of the pain can be valuable for determining the source of the pain. Now, true glenohumeral pathology, what's quite common is that the patient will grab onto their glenohumeral joint area. If it's more of like an impingement type problem, more of a labral type problem, or instability, typically they'll kind of grab onto this area. And if it's more of an acromioclavicular and AC joint injury, then oftentimes they'll pinpoint and say it hurts right up here on the top of the shoulder. And there should be, again, some sort of a history that would make sense there. Either they've had a fall onto the shoulder, they've had a history of multiple traumas to the AC joint that could result in an osteolytic process where they're getting some bone necrosis. So the location of the pain should help clue you in as to whether or not it's truly a shoulder problem or whether it's coming from the cervical spine.